Hello, everyone. My name is Leo, and I am a registered nurse in the state of Nebraska. I am here to talk to you about the benefits of the implementation of universal health coverage. So, I would like to start off this video by explaining what exactly is universal health coverage, because what is it? Like, exactly. So, universal health coverage is basically this idea um, by the World Health Organization that everyone, all individuals and communities of a certain location are able to receive the health services that they need without suffering any financial hardships of any kind. So, basically, what that would look like in the United States specifically would be a government funded um, and taxpayer funded health insurance program that would help fund the health coverage of the entire population. So, basically, take Medicaid and Medicare, but without all of the restrictions and limitations that come with it, and having to file for it. No, everybody in the United States would be granted this. Every citizen in the United States would be granted this and would be able to either utilize this health insurance, this publicly funded health insurance, or if they wanted to, if they so wanted to, they could use a private health insurance. So, what I want to talk to you about is the benefits that this would provide for the entire United States. So, first and foremost, it would ease the access to healthcare for everyone. I mean, one of the biggest deterrents to healthcare, to receiving healthcare services by many people, is the cost. The cost of healthcare. I mean, it's way too expensive to go to the doctor for any reason. So, let alone if you don't actually feel like what you are going through is something worthy of going to see the doctor. And so many people don't. Many people just wait until it's too late, and or it's just their condition is snowballed into something that's, well, only treatable in the hospital. So it would not only ease the access to healthcare for everyone, but it would also decrease the medical debt that people are burdened with every single day. Because if there's something that we hate more than health insurance companies, it is medical debt. Because medical debt is a burden that only we Americans really go through. Because every other developed country already has their own publicly funded health care system. And so medical debt would thus become an issue of the past because people would be able to go to a healthcare facility and receive the care that they need without having to worry about paying. Because if there's something that we need to, as a society, understand is that healthcare is not a commodity, it is a necessity that everyone should have the right to receive. So, not only would it decrease the medical debt that is burdened by the people of the United States, but it would also make private health insurance an option rather than a necessity. Because, I mean, there again, we need to outline that healthcare is a necessity for everyone, regardless of who you are or what you have done or what you've been through. It is a necessity for all people. And so this would make private health insurance instead of a necessity as um, as the Institute of Medicine back in 2002 outlined um, very thoroughly, the effect that health insurance has had on healthcare has only been that we require healthcare or health insurance to receive healthcare. Without health insurance, people go, but the health outcomes of people are greatly diminished. And so, thus, we depend on health insurance companies to receive healthcare. And that is not something that we should be dependent on in order to be able to live. And so, thus, I, I believe that it is a necessity that we make private health insurance a option not a necessity. So, on top of that, the passing of universal health coverage would improve the overall health of the entire population, not just the richest few, not just the poorest few, not just the middle class. It would make it so that the overall health of the entire population is improved, and thus we have a healthier society. Mental health is actually uh, advocated for and pushed for and cared for, and so thus we would have a safer community as a nation overall. And so, um, through this, I want to pass on to you that you as an American, you as a citizen, you as not even just a citizen, just somebody who lives in the United States, who has breathed, lived, worked, and done, been in this country and enjoyed the fruits of labor that this country can provide. I want you to think about what you want for the future of this country, because if there is anything that you can do as somebody who lives here, somebody who has been here, who has breathed the air of America and gotten to enjoy what it is to be here, your ancestors who came here to provide a better life for you and your children and all of your family. I want you to think about what change you can make with the passing of universal health coverage, because your voice matters in this affair. Because with your voice and your advocacy for this, the implementation of this policy in the United States would benefit everyone. Everyone. So, are we going to do it? Or are we just going to continue to sit around and do nothing? My name is Leo. I'm a registered nurse in the state of Nebraska, and it has been a pleasure being here.